Welcome to Everything Mental Health Podcast.
Hello.
Hello.
Hi, Maureen.
Hi, Chris. Welcome.
Thank you. Welcome as well. And just to get it started, I'm just kind of wondering what you are hoping to do with this. What are you looking for as far as this goes?
Well, I think that the whole sort of idea about this podcast is sort of devoted to addictions, mental health, and trauma, because they all seem to kind of be interrelated and go hand in hand. And there's not a lot of, podcasts or information that out there that really come from like an experiential sort of place. And I think that sort of, having a voice for this topic, and to support people who are going through addictions. They may be trying to get into their own recovery, or people that are in early recovery and or later recovery and just in their journey. So that's sort of that's kind of where I'm coming from.
Cool. So can you just tell me about yourself a little bit in terms of your history?
Yes. So I guess I've been in healthcare now for over 30 years. I began back in 1992 as a registered nurse. I went to school for nursing in Toronto, Canada. And we have to say Canada because we might be getting people listening from other countries.
Right, okay.
And I did a whole bunch of different kinds of nursing. So, oh my gosh, hospital nursing, community nursing, home care nursing, labor and delivery. I was a school nurse once. Did a whole bunch of things. And then I got a job at public health and became a street nurse. And it was a mobile van service. And it did outreach to people on the streets, homeless people, people with addictions, intravenous drug users, sex workers. And I really found my niche there. I loved it. And I was there for many years. And from there, I did methadone clinics and high-risk women who were involved with addiction and high-risk behaviors, and really love supporting people in that field. And then I ended up from there realizing that I wanted to be a counselor. And so I went back to school and did a master's degree in counseling psychology, and I've been working in that field for the last 7 years.
Lovely.
And worked in a men's inpatient treatment center, do private practice right now, and continue to do a lot of work in mental health, addictions, and a lot of work in trauma.
Very cool.
And what about you? Where have you come from in this?
Well,
in this?
What sprung to mind were the parallels, some of the parallels that I was listening to you and so on and in our lives, because I too worked through in my teens and early 20s. I worked through my own addiction issues, and those are in the ancient days past, and subsequent to that, the only direction that I felt that I had to go in was in service in one capacity or another. And so for over 30 years now, similar to you, I've provided service to individuals and groups working towards psychological, social, emotional, and spiritual, biological development. And I have experience and training working with and developing and or facilitating workshops for people with disabilities, adults with addictions, adults with anxiety and mental health concerns, at-risk youth, unemployed and homeless individuals. And I even love providing service for young kids. And as I continue to learn, I see myself as an elderly kid as well. My training was through not only experience working with a number of agencies, but also through the Justice Institute of BC, and that would include case planning and management, case management, counseling, behavior management skills, anger management, substance use and addictions counseling, and ethics and sound practice. As a musician, also I enjoy facilitating community drum circles for all ages, and therapeutic drum circles for those in recovery programs. Currently, I work for an inpatient treatment center for men and women, and at a recovery house for men, and provide support for them as they transfer to the sober living second stage. So I see some parallels there between you and I, and which is why I feel that having known you for a while now, it just seems to be a lovely flow that occurs when we get together and discuss these matters. And so I think it's a wonderful thing that you're doing to bring awareness to the matters of addiction, recovery, and most importantly, aftercare as well.
I really resonate with what you said, Chris, and that's another thing. I have struggled with addiction as well, and have family members who have and do struggle with addiction, and have lost family members to addiction. So I'm in 10 years recovery right now from my last bout with addiction, and that's I'm very adamant that is my last bout with addiction. However, saying that, I still struggle with sugar addiction.
Same here.
It's insidious, I tell you. So I'm very excited to embark on this podcast journey with you, and looking forward to all the topics we discuss.
Yes.
And where it takes us.
Absolutely. Because working in this field, the enjoyment for me comes from watching the transformation that can occur when someone learns a little bit more about their world and around them, as well as their world within. And it's a reciprocal thing. I continue to grow and learn as a result of this as well. So I love this and the journey, and who knows where it'll take us, but I'm excited about it.
Thank you.
Yeah.
Well, let's get started.